Let's dive deep into the shadows of drug addiction to uncover what really lies behind it. Drug addiction is a pervasive issue that affects millions of people worldwide. It's an epidemic that has been ravaging communities, destroying families, and claiming countless lives. But despite its prevalence, drug addiction remains shrouded in mystery. We often focus on the surface-level symptoms, but rarely do we delve into the underlying issues that drive individuals to substance abuse. There are various factors that contribute to drug addiction, and it's essential to recognize that it's rarely a simple case of poor decision-making or weak willpower. Mental health issues, such as depression, anxiety, and trauma, can create a sense of desperation that leads people to seek escape or relief in drugs. Additionally, societal pressures, like peer influence, upbringing, and economic hardship, can also play a significant role. The truth is, drug addiction often stems from a complex interplay of genetic, environmental, and psychological factors. The current social climate can exacerbate the problem. Social media, for instance, creates unrealistic expectations and promotes a culture of comparison and competition, leading to feelings of inadequacy and low self-esteem. Moreover, the stigma surrounding mental health issues and addiction can prevent people from seeking help, making it even harder to address the problem. The rise of prescription drug abuse is another critical factor. This highlights the need for a comprehensive approach that tackles the root causes of addiction, rather than just its symptoms. Opioids, stimulants, depressants, and hallucinogens are just a few examples of the many types of drugs that are commonly abused. Each has its unique effects, risks, and consequences. Opioids, for instance, can induce a sense of euphoria, but they're also highly addictive and responsible for thousands of overdose deaths annually. Stimulants, on the other hand, can increase energy and alertness, but they can also lead to cardiovascular problems, malnutrition, and psychosis. The consequences of drug addiction are far-reaching and devastating. It can lead to financial problems, strained relationships, and even criminal behavior. On a larger scale, it burdens the healthcare system, law enforcement, and social services, ultimately affecting entire communities. Kim, a 32-year-old mother of two, started using opioids after a painful divorce. She was struggling to cope with the emotional pain and felt isolated from her friends and family. As her addiction worsened, she lost her job, her kids, and eventually, her home. But with the help of a rehabilitation program and a supportive community, Kim was able to overcome her addiction and rebuild her life. Her story is a testament to the power of compassion, empathy, and understanding. Drug addiction is a multifaceted problem that demands empathy and compassion. Thanks for watching at Zuri's Resilient Network.